Good morning, everyone. Let's talk about a situation where you finish a large treatment plan. So, let's say, for example, you're doing full clearance or placing some implants. Then the patient walks out to the reception saying that I don't have the funds, or I don't have cash, or I don't have my card, I can't pay today. They walk out of the practice and you never get your payment back. You call debt collection agencies and they try to chase the patient and you never see your money back. And you feel like you worked so hard, you've spent 2 or 3 hours in these appointments, and it feels like a letdown. So I want to share with you in this video what procedures you should get payment for before you do any treatment, and why, and how can you do it, and how can you communicate with your patient, and also how to avoid that even in an emergency situation where you only have like a very small treatment plan as well from happening. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own and run my own dental practice, Lakeside Dental Spa in Hervey Bay in Queensland, and I've been running my practice for the last 14 years. I took it from one chair to 10 chairs, from one staff member to close to nearly 40 staff members now. So check my details below for credibility. So I'll give you examples. For example, that happened to me before, where a patient was booked for a full clearance and denture insert. I think back then the plan was maybe $1,500, something like that. And we're talking about 15 years ago or longer. And then the patient walked out after the appointment. We spent like 2 or 3 hours. I was a new graduate then, taking all those teeth out. And then the patient walked out to the reception saying, I don't have my money today or my card today. I'll pay you later. And we never received payment. So procedures that there are no like finish, the treatment is not finished, you have to get payment before. So for example, let's say you're doing multiple crowns. I will get payment before insert anyway, but if you have a second appointment where you have to insert the crowns, yes, maybe you have a window where the patient is not going to run away and not pay you back. And but other procedures that the patient doesn't have to see you after, so for example, clearance, full extractions, implant insertion, when you're placing implants, final crown or veneer insert. Any appointments on that type, you have to get payment before treatment for many reasons. Number one, if the patient doesn't have the funds or doesn't have the card, then you can sort all this out maybe 1 week even before the appointment. You don't have to sort it out after the appointment. So that's where a chance where they say I cannot afford it, or I don't have these funds, and you can talk about payment plans, and also will show you if the patient is dishonest about their willing and their financial consent that they are willing to pay for the treatment. Number two, it gives you the peace of mind as well. So when you're treating the patient, you know you're gonna get paid for those treatment, even if they disappear and never come back again. At least you got paid for your treatment. Number three, some of those procedures you might have to book a long appointment, and it shows a bit of commitment from the patient side when they prepay for the treatment. Number four, after the procedure, the patient will be numb, especially with clearance and dental implants. They might be sedated, they might be very tired. The last thing you want to do is sit them in the front desk with your receptionist, trying to sort out payments and health fund and credit cards, and they can't talk, they numb, they have stuff in their mouth. It's not a really good look for your front office anyway. But if you do that before the appointment when the patient is not numb, it's very beneficial. If you have the habit of doing that, you'll never have this issue of the patient running back and not paying you back. Unfortunately, we have to accept that maybe there's 0.001% of your patients that might be dishonest to you, and they might have this sinister idea of not paying you and getting their treatment done. But by doing that, you can screen those patients early on. So how do you communicate to patients? Keep it very simple. Think of surgeons in hospitals. If you are performing any, as a patient doing any surgery in a hospital, surgeons will always get prepayments, and hospital will get their fees done even before the procedures. Same thing, what they use, they say, this is our standard procedures, this is our standard policies. So I will tell my patient as a front office, our policy for any surgical work or for any treatment of that nature, let's say dental implants, you have to create a list of those treatments that you want to get prepayments. Our policies for the treatment is to get prepayments, full prepayments 1 week at least before the procedures. You can do this via bank transfer. We can take your credit card over the phone. We can set you up a payment plan. How would you like to pay for that? It's just happening. It's not an option. We're not giving the option. Either they have to pay upfront, transfer to our bank, get their card details and bill it, or they set up for a payment plan. And also, we can tell them, and by the way, most patients really like that because the last thing you want to do after the procedure when you're numb and you're tired and your mouth is like sometimes a bit swollen and uncomfortable is to sit on the front desk trying to sort out payment. So we do all of that before payments. So I do that for surgical cases, for of course sedation and general anesthetic cases as well. But you can create a list of the procedures that your front office have to collect funds before the procedure. If you find this information helpful, make sure you like and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel and you'll be notified when more videos are released. Thank you so much for listening to me.